Polk County has a high population of elderly living here. And of course, one of the diseases that most affects those elderly is Alzheimer's. It's reported that nearly 14,500 people just in Polk County are affected with this disease. Here to talk about Alzheimer's is Stephanie Thompson. She is the program specialist for the Alzheimer's Association, the Florida Gulf Coast chapter.
Correct, yes.
Stephanie, thanks for coming on.
Thank you very much for having me, Steve.
Now, for those who aren't familiar with the Alzheimer's Association, tell us a little bit about the program.
Sure. The Alzheimer's Association is a national nonprofit organization. Our headquarters is in Chicago, and every state has chapters that produce programs at a local level. And I work for the Florida Gulf Coast chapter. We actually serve 17 counties in Polk County. The amount of people that we serve is extraordinary. In our county alone, like you said, according to the Department of Elder Affairs, there's about almost 15,000 cases of Alzheimer's disease. And there's other types of dementia too, so we see other types. If you consider who's caring for them, the majority of them are cared for at home by a family member. So that number of people that are actually affected by the disease multiplies at least by 2. So there's a lot of people that's actually affected and need services. We have a helpline number, so we get a lot of people that can call in and get information from us or get referrals. Sometimes we'll get calls to that number, and caregivers can call in and get information about the disease. They can ask questions. We can kind of lead them and guide them during their care management process of their loved one. We also get individuals that will call that have concerns about their loved one. Does this sound like it could potentially be a dementia or not? Those are some of the questions that we get. And we'll refer them to a doctor. We're lucky to have a new memory disorder clinic that just opened up in Winter Haven here in Polk County, so we can refer them there. Or there's Watson Clinic, Neurology and Associates, or Clark and Daughtry here locally. There's other neurologists too. So we have a lot of information that we can share. So hopefully people, if anybody's listening to this that is, experiencing this disease or has a loved one with the disease and they're feeling kind of isolated or trapped, they can call our office so we can give them some resources.
And it sounds like there's so many options for help available. There's really no reason to be afraid or to sit back and say, well, I don't know what to do, because there are so many options here.
Yes. There is a lot of options. I think a lot of times what happens, though, is when you see your loved one maybe forget a couple things, there's such a stigma when it comes to dementia and to brain disorders in general that people tend to shy away from it, maybe ignore it, or maybe just accept it as normal aging. But as research has shown, and as we know, Alzheimer's is not a part of normal aging. We do know some statistics about it and some risk factors. For example, the older we get, the more likely it is for us to develop the disease. After the age of 65, you have about a 1 in 8 chance of getting it. And unfortunately, after the age of 85, it's about 50% chance of getting the disease. So I just would encourage anybody that is feeling like they might have some thinking problems or some memory difficulties, that they get a hold of their medical professional. And if their medical professional is not really listening to them and taking them seriously, that they go a step further and do go see a neurologist or a neuropsychologist.
Now, a lot of times you see somebody with Alzheimer's and they don't really recognize their memory loss.
Yes.
But as a loved one, what would be your recommendation for someone who's maybe seeing memory loss in a loved one?
Right. And there's different reasons why somebody might not be recognizing it. It could be denial, which is totally different, but it could actually be part of a disorder of the brain that they're just never going to accept it. And I've actually seen both cases. A family member, it's really difficult to get somebody to really accept something like that. I would say just loving them and supporting them and letting them know that everything is going to be okay. And really to rely on medical professionals to kind of help out with that. Unfortunately, there is no cure for the disease, but the medication that we have now works best if it's given early on in the disease. So that's what I would encourage people to do, is just to get that diagnosis, and if they do, potentially if they do have it, they could at least get that medication early on.
So is there some type of screening or something, some type of test that you can go through if you are noticing signs of?
we would recommend giving a real thorough evaluation because there's lots of things that affect our brain. For example, if you didn't sleep tonight, you might have a difficult time remembering things. Or if you're not eating properly, if you skip a couple meals, it's kind of hard to concentrate. Depression can cause problems too. That can actually look like a pseudo-dementia. Diabetes, can have an impact on your brain. So you really need to get a really thorough evaluation done. There is some simple questionnaires that can be looked at to verify if in fact there is some kind of problem, but that doesn't really say what the cause is.
Right.
So dementia, for example, the definition of dementia would be several symptoms related to cognition, memory loss being one of them, or not. It doesn't have to be memory loss. It could be, executive functioning difficulties. But you have to have several symptoms severe enough to be interfering with your daily life. And once that diagnosis is made, the next question should be, well, what is that cause? And it's difficult to find out, but there are ways to do it. They can be about 85 to 95% accurate on the type of dementia with a diagnosis.
Now, are there different types of Alzheimer's? I mean, are there different variations of it that you may or may not recognize it right away?
Yeah, well, there is a young onset and a late onset. The young onset would be somebody getting the disorder before the age of 65, and then the late onset, of course, would be the opposite after the age of 65. The young onset, it's between, I've seen them in 40, somebody in their 40s could actually get that. That's very rare. It's probably 1% of our population will see that. There is somebody that lives in Polk County that's been in the newspaper. The Lakeland Ledger has been following him and his wife, and he actually has that young onset type. So, I mean, it's rare, but I've seen it. And then there's, the late onset, and I've seen people in their upper 60s get it, and I've seen people in their upper 80s get it too. There is some genes involved with it, but just because you have a gene doesn't mean you're necessarily going to get it.
Right.
We know that it's a biological mechanism that's going on, but we also believe there's environmental things happening. So it's really important right now that we support research so that we can figure out really what is the causal factors that are related to this disease process so that we can actually stop it. We've come a long way, but there's a lot more we need to do.
Right.
If somebody out there really wants to help with that, I would tell them to join the Walk to End Alzheimer's, because that's really the best way right now that we can do something as a community to help find a solution to the problem.
The Walk to End Alzheimer's, tell me a little bit about that.
Our walk is every year. This year it's going to be around Lake Hollingsworth, which is a 3-mile walk. I know that sounds long, but we're going to put up some mile markers so that people can walk maybe a quarter way around. And what we do is you can form a team and help raise money for your team, and that money goes directly towards research and local programs.
Excellent. Tell me a little bit about, I know that we had talked about some of the resources that are available. Tell me a little bit more about the Gulf Coast chapter.
Okay, sure. Our website has a lot of the things that we do on there, but some of the main things we do is we do take in those helpline calls like I mentioned. We also do a lot of education, not only to just the general community to talk about the brain health and what is dementia, but we also have programming for caregivers to let them know, how to be a caregiver. We're not born caregivers. I mean, moms and dads, they learn how to take care of their children, but when you're caring for somebody that's an older person, it's much more different, especially if it's somebody that you're in love with, if it's your spouse. Those emotions can get really involved. So we've got, how to understand difficult behaviors would be something that we would talk about, or better ways to communicate with somebody that no longer is communicating. How do you actually do that? We also support safety programming. So we have a Medic Alert Safe Return program, which is an identification program that can help people keep their loved one more safe if they're, do get out, and let's say somebody with the disease thinks that they're going to go to work, but actually they're not working anymore, and that can happen. And they leave the house, they're going to be confused and not be able to get back. So some kind of a safety device on them can actually help relocate them. And there's 2 main programs that we support. It's the Medic Alert Safe Return, which is an identification program. And then we have a program called Comfort Zone, and it's more of a GPS program. There is other programs out there, and I would advise caregivers to kind of do research to find what best fits their situation, and they can always call my office to get more information on that.
Now, you had been mentioning the education for for the people without Alzheimer's, for the people whose loved ones have Alzheimer's.
Yes.
That's a pretty key, important part. What would you say to a loved one that has, what would you say to someone who has a loved one with Alzheimer's? How do they go about?
I would want to let them know that they're not alone, that I know that at times they probably feel very isolated, and just let them know that there's information out there that could actually be a supportive to them. We do have support groups too, and sometimes caregivers feel more comfortable in that type of environment because they're learning from a peer, or rather they're learning from another caregiver just like them that's going through the same situation. So some people prefer that, or some people prefer, more of a straight lecture or audio type of education. But I would just encourage them, and a lot of caregivers say to me, I knew about you a year ago and I'm just now, and that's fine, because sometimes it takes time to reach out. But I would just encourage them to keep our number handy, and if they can reach out, do, because they do need that support.
Excellent. Well, it sounds like there's more than abundance of options and education, resources and materials that you guys make available, to help those Alzheimer patients and their families. Stephanie, thanks for coming on. Really appreciate it. You're welcome to come back anytime and talk to us about what you have going on.
Thank you so much.
Thanks, Stephanie. That's the Alzheimer's Association. The Florida Gulf Coast chapter provides a support system for those affected by Alzheimer's disease or related disorder and their caregivers through patient and family services, education, advocacy, and research. And you can get a hold of them at 863-292-9210. Or you can go to their website at www.alz.org/FL Gulf Coast. You can also reach the association through their confidential helpline at 1-800-272-3900.